Welcome back to the Midweek Update. Hey Mepham, we're here in week 5 of the coronavirus shutdown. This week, we're taking an inside look at what's going on in our local hospitals, and we're revisiting the interview with a doctor from the last episode. This and more as we take a look at what's going on this week on Midweek Update. I'm Haley Hapworth. And I'm Riley Freed, and welcome back to the Midweek Update, the B&B show that brings you closer to the people and places in and around the Mepham community. Last week, we got to see what a medical professional had to say about the coronavirus. Now, let's hear his thoughts on why the disease spread so quickly here and what's going to happen next.
The coronavirus has been affecting the whole world, but New York has been one of the hardest places hit. Dr. Robert Pittman discusses why this could have happened.
I think probably for a couple reasons. Number one is that the virus started overseas, and New York is a very international city. Then once it got here, the density of population in New York City is the most in the United States. So if you've ever been to Manhattan, you know how crowded it is, not only with how many people live in close quarters, not only in Manhattan, but in Brooklyn, Queens, and Bronx as well. But the whole idea of people coming into Manhattan to work from outside and being together on public transportation and in large buildings that have a lot of traffic with people going up and down elevators and pushing buttons, and there's just a lot of people in close contact with each other, and then they disperse at the end of the workday and they go to various suburbs and outer boroughs, and then whatever they picked up that day they then give to people that are where they live, and it all of a sudden you have quite a nidus of infection.
As we get closer to the apex, or the maximum amount of people sick in the given community, we have to start thinking of what will happen after that. At that point, Dr. Pittman believes things will start to look a little different.
At the apex, the important thing about that is we can then start to plan to scale down our efforts a little bit. And if you think about it this way, New York is the beginning of this, but we anticipate that it's going to spread throughout the country. And if we're borrowing things in New York from other parts of the country to help take care of people, once we hit our apex and we know that other parts of the country that we borrowed materials from are going to start to now see more and more cases. Once we've hit our apex, we know that we can start to give that equipment back to them so that they can then deal with things. And as they reach their apex, they'll start taking things from New York. So that's important in terms of the planning. And also with respect to social distancing, that helps as well too. Once we've hit the apex, we know that we can start to make plans to decrease some of the social distancing measures and move towards a little bit more normal of a life.
Dr. Pittman has hope that other places' kindness towards New York's struggle will show how really interconnected we are.
This is a situation where we are all really in it together. You know, from how the virus spreads from person to person, that every person has to be responsible in how they handle this in order to keep the rest of the world healthy.
For B&B, I'm Emily Rosenberg.
Thanks, Emily. It's good to hear the thoughts of doctors about the future. Right, but let's focus on the now. We've all been stuck inside with most places closed. And with everyone at home with nothing to do, sometimes personal hygiene may be forgotten. Here's Luke Melfa with a special look into how to be hygienic during the quarantine.
Everybody get up, it's time to slam down. We got a real thing going down. Welcome to the Space Jam. It's your chance to dance in the Space Jam. Alright. Oh, alright, I think I'm done. Yeah, I think I'm done. Huh. Well, that was a lovely shower. I think I'm gonna. Oh! Hey! I didn't see there. Anyways, let's talk personal hygiene.
It's extremely important, especially now that everyone runs the risk of getting coronavirus. But not only that, you and your family are stuck inside pretty much at all times, aside from when you lock yourself in your room to watch Netflix. But, I digress. No one quarantining with you should be forced to smell your BO because you're too lazy to shower. Nor should they have to deal with your bad breath because you don't want to pick up your toothbrush. Then again, we're all inside all day anyways, so while showering is important, what's the point of getting dressed or putting on makeup? I myself have not been putting on my makeup or wearing pants, except for on special occasions. But I want to know, what are other people doing to take care of themselves while they're stuck inside with limited resources?
Yeah, I consider myself to be a clean person generally. I'm a clean person. My daily hygiene routine consists of showering in the morning, brush my teeth after I get out of the shower, applying deodorant, sometimes washing my face, and then rinse and repeat.
Cool.
It hasn't changed much from when before this COVID virus 19 started. I get up in the morning around, not as early as they used to, around 7 o'clock, get dressed, shower, shave, everything I normally would do.
If you have not been performing any of these basic hygiene activities at some point during the day, first of all, I'm sorry for whoever is stuck with you, and second, stop this video right now and go do them. Please. I beg of you.
Okay, and what have you been doing about your hair considering you can't get a professional haircut done?
Nothing.
Sick.
Absolutely nothing.
Nothing with your hair.
This is a mess, and I can't do anything about it. So I've kind of just done nothing about it.
I respect that. Just a little. Have you considered just taking the scissors and just going yourself?
Thought about it.
Go through with it?
Mm-mm.
Okay.
Yeah, the challenge with that is that obviously you can't go for haircuts because there's nothing open. So the only thing I can do is I basically just wash my hair, dry it, blow dry it every day. I feel it's getting a little bit long for me because I used to have very long hair back in the day, like down here. But now it's a lot shorter, and but it is getting longer for me right now. I just do feel it getting longer. And the challenge being now is that if I don't blow dry, it gets a little frizzy and starts to. So I usually try to blow dry and keep it down.
Oh, my hair's getting a little long. Yeah, I'm gonna need a haircut. Hey, Ma? No. Okay. I do not think I can reiterate this enough. Your hygiene is important. And despite the lack of human contact, it's really good to know that everyone is trying to keep themselves clean every day. So whether you're wearing your fanciest clothes or you're sitting in your pajamas every single day of the week, make sure you're not wallowing in your own filth. Otherwise, everyone's going to judge you. For B&B, I'm Luke Melfa. Come on and slam, and welcome to the jam.
Thanks, Luke. That was definitely interesting. But in all seriousness, hygiene is a very important thing at this time to stop the spread of coronavirus. Especially in places like hospitals. Let's take a look at what's going on in a local hospital during this pandemic.
Due to the coronavirus, everyone's been told to stay indoors the last few weeks. But there's one group that goes out every day, specifically the medical field. They're working overtime against this crisis, and to be honest, we don't even realize the effect it has on them.
Nurse Vaquero works part-time at Maimonides Hospital in the neonatal intensive care unit, where she takes care of the newborn babies. But during this pandemic, she's had to take very different precautions with what she does. Most important being masks. 12-hour shifts wearing the same mask for a week started to get difficult for the nurses.
When this first started, our manager gave us a paper bag with our names on it, like a lunch bag, a mask, and said, "This is your mask until it's no good no more." She said, if you cough into it, if you sneeze into it, if you feel like it's getting run down, you could ask for a new one, but basically it should last you maybe a week or so.
The parents and babies who are infected are also not able to undergo a normal delivery because they're not able to see each other until they test negative for COVID-19.
Once the baby is born, they come to us, and we know the mom is COVID positive. We put them in isolation. We test them, but we don't get the test right away, so it takes about 2 days. So they stay in isolation. We have to gear up the whole thing. We put the mask on, the N95s, the hats on, the gowns, and for 2 days we take care of them in isolation. And then after the 2 days, if they're negative, they come outside of isolation. But we still keep them in an isolette, and we still gown up. If the mother is positive, we're going to assume the father is positive. So until there's a negative test, neither the mother or the father is allowed to visit.
In the meantime, they have created a way for the parents to connect their phone or computer to cameras that are on the babies.
When you walk into the hospital, there's a huge waiting area. There's couches, there's tables and chairs, and usually it's full. So one day I just walked in and it was completely empty. They just emptied everything out. Everything was cleaned out. There were no visitors allowed at all. Nobody, like if you go into the hospital, anybody you love goes into the hospital, you're basically checking them at the door.
This way they can still see their newborn without contamination. Along with these different procedures, the hospital has done away with all visiting, no matter what you were there for.
It's just, I feel like it's, and I think other nurses too, it's like psychologically we weren't prepared for it. Like, you join the Marines or you join the Army, you get psychological training. And even then, they come back with, post-traumatic disorder. It's very traumatizing. It's very traumatizing to walk past a block full of bodies. It's very traumatizing to hear codes all day long and know that people are hurting and in trouble. It's a very different way of life. Work is not fun. It's not happy. It used to be, and it's not anymore. So, I don't think I'll be the same, but hopefully we'll get through it.
Since there's no visitors, the halls are quiet and dreary, adding to the sadness of the virus, which extends down the block.
It started out like an ice cream truck kind of truck, and that was for the morgue is full, so that was just the overload of the morgue. So it was just like, it started out like ice cream truck size, then it was like 18-wheeler size. Now it's like they're building tents there and the whole block is blocked off.
So what's it like to see that every day?
Well, it's really depressing. It's very depressing. It's very depressing to walk by there because the parking lot is right next to it, so I have to pass it to go into work.
Right.
So it's very sad.
Seeing this every day takes a certain toll on the essential workers that we don't even realize because we don't have to deal with it to that extent. After passing the trucks in the morning, the nurses and doctors go throughout their day listening to constant stat codes, which are for the people who are being intubated or going into cardiac arrest, which used to be every few days. After seeing this, Nurse Vaquero can't imagine being the same after.
I feel like and I think other nurses too, it's like psychologically we weren't prepared for it. Like, you join the Marines or you join the Army, you get psychological training. And even then, they come back with, post-traumatic disorder. It's very traumatizing. It's very traumatizing to walk past a block full of bodies. It's very traumatizing to hear codes all day long and know that people are hurting and in trouble. It's a very different way of life. Work is not fun. It's not happy. It used to be, and it's not anymore. So, I don't think I'll be the same, but hopefully we'll get through it.
Not only for herself, but for the world as we know it, at least for the next year.
Along with Mary and Vaquero, there are thousands of others risking their lives every day to bring our country back to normal. Reporting for BMB, I'm Lorrie DellaCroce.
Thanks, Lori. It's interesting to see how everyone is handling what's happening. They're doing great work there for people in need. Exactly. And somewhere else that's helping people is the community cupboard. This food bank is a great resource for people here in our community. Let's look back on the creation of the cupboard and see what it's doing to help people now. With many aspects of everyday life shutting down due to coronavirus, many people in the community are in need of help. The BMCHSD schools and community cupboard have been doing what they can to assist the families in Bellmore-Merrick during this time.
So the community cupboard is kind of just like a district-wide, community-wide food pantry.
We're a food pantry that works to provide families in the Bellmore-Merrick area with food, toiletries, school supplies, and any other basic needs that they'll have.
The community cupboard was started a few years ago to help feed families in need in the neighborhood. Families have been able to pick up food that has been packaged and collected by students and faculty in the district.
We decided why not start in our own community before expanding outwards, and that's when the community cupboard became a thing.
I think our biggest thing is just being a reliable place people can get food from.
The district normally holds events throughout the year to collect food and money for the cupboard, but during this time, more than ever, the cupboard and the people relying on it need help.
So there's always been our 5K. That's probably the most famous thing that we've done. And we just collect money for entry tickets and snacks. But we've also run things such as MLK Day of Service, which is done in the schools, all the bagging food, and a lot of other events where we just put together meals or delivered them to other shelters or places that would need them.
People have gotten actually very creative. We have one person who came up with a social distancing food drive. So she asked all of her neighbors, if you have any food or want to put anything out, I'll come around and collect from like your driveways and I'll bring it over to Brookside. So people are getting really creative with that.
They can either email myself, Miss Christensen, or Miss McMahon to get information because we have a black bin outside of the Brookside building from 9 a.m. to 12 p.m. Monday through Friday, weather permitting, and they can drop off their donations there, which is very greatly appreciated because we don't have those events going on since the schools are closed down. Our big supporters, the kids, can't really donate now, so we're looking to the community to fill that gap.
As far as donations, we definitely can use like any types of condiments, like ketchup, mustard, mayo, salad dressing, things like that. Canned proteins like tuna fish or chicken or chili, any kind of like snack items. Definitely we could use, like, I think everyone's on a toilet paper rush, like toilet paper and paper towels, garbage bags, cleaning supplies, anything we really appreciate.
How can someone in need receive help from the cupboard?
It's very easy. We ask no questions. All they have to do is either call the number 992-1073 and leave a message on the cupboard and someone will get back to them. And also one of those emails.
The community cupboard is a great resource for families during this pandemic. Everyone that can help should consider doing so to make sure the cupboard is there for anyone who needs it. From B&B, I've been Lily Yepez. Thanks, Lily. The community cupboard is really helpful to many families in our community. So that's it for this week's Midweek Update. We'll be back next week with all new stories from around the BMCHSD to bring you inside the parts of the community we don't always get to see. Until then, I'm Haley Hapworth. And I'm Riley Freed, and we'll see you next Midweek.